This video is brought to you as part of the Paired Health Mobile Medical Care Educational Series. In this module of the Mobile Medical Care Series, members of the Paired Health Care team share some of their experiences with common home visit situations encountered and some tips for ensuring that their safety is not compromised when going into unfamiliar environments. Let's hear what they have to say.
Luckily, I'm going out with a care partner, so I'm not alone, and that's important. But if there are some things that kind of make me a little uneasy or have the hair on the back of my neck stand up a little bit, I'll stand for the interview, kind of stay close to the door, ask to do the interview outside, or have the door open to the person's home. There are situations where there's been a big dog out in front of the house, and we won't get out of the car until we get in touch with the patient and they remove the dog before we go into the home. And then I've never had this happen, but if I felt unsafe, or if we both felt unsafe, and I would have to stop the interview and we'd have to do it at another time or somewhere else.
Has there ever been a situation where you conducted an initial visit with a patient and did not conduct a follow-up because it could have been unsafe?
No, that hasn't happened. That hasn't happened, but that would be a possibility. So there has been a situation where a patient's asked me for money before, and my basic policy is that I don't carry cash with me when I go into people's homes. I feel that it's safer for me, and so if they have asked before, I just say I don't have any cash with me or any money with me, and that seems to be fine. They understand that.
One of the issues that we encounter in making house calls is how to safely park the car without getting damage either to the car or, even more importantly, to your tires. So we have found that in all circumstances it's best to park in the patient's driveway, even if you have to block them in temporarily. We've also discovered this year that we've acquired at least 3 flat tires, and that was due to, we didn't think any negligence, but it simply happened. So what happens with a flat tire, we've been very fortunate so far. They've been slow leaks. We've been able to get home and call a tire shop and have the tires repaired. But I suggest that you have one of these in your trunk, your glove compartment. It's a little inflator, costs about $11 from AutoZone. And what it allows you to do is when you do have a flat tire or you notice a slow leak, you attach this to the battery portal in your car with your engine running perhaps, even not so necessarily, and you simply inflate your tires so that you get through the day or you get to a tire shop. So it's a key element to have.
Have there been situations where you have conducted visits in the car or other locations, say if there's a home where you make the decision to not go in for safety reasons?
Yes, sometimes patients don't want us to come into the home, and that's not always found out until we get there. There might be a family member in the home that they don't want to hear their personal information, their health history, and so we've done the visit inside the car. That's happened. I've also seen people, met them maybe at a motel or a hotel, and they, again, maybe somebody's in the room that they don't want to hear what's going on, or we're maybe not allowed to go in that room with them, so we've done the visit in the car.
Many times we're sent to see patients that are in hotels and motels. Sometimes our patients are homeless, sometimes they're construction workers, and sometimes they're individuals who are relocated into the area. One of our tips is that we always check in at the hotel or the motel's main office, and we let the person in the office know that we are seeing a patient in a particular room. When we go to that room, we ask the patient to please keep the door of the room ajar. After we leave the room, we go back to the main office of the hotel or the motel, and we let the reservationist at the main desk know that we are leaving now. We do that for safety issues to make sure that the hotel individual knows that we went to see the patient and now we are leaving.
These are only a few examples of situations that our provider teams have encountered in the past and their suggestions on how to handle the specific circumstances. Of course, there are many other scenarios that a mobile provider may encounter, and some that may require a visit to be terminated midway through or canceled altogether. Also, as mentioned by Jan, it is often beneficial from not only an efficiency perspective, but from a safety perspective as well to have the provider accompanied by another individual when conducting home visits. For example, this may be a CNA or an MA who can help out with patient triage while also providing a second set of eyes in the home. This can be especially reassuring when visiting a particular patient or geography where the extra precaution is only common sense. Thank you for watching, and please check out our website for more informational videos on mobile medical care. Thank you for watching this segment of the Paired Health Mobile Medical Care series. Remember to check out the rest of our series and much more at www.pairedhealth.com.